Here, we're out at the Mount Prospect Farmers Market, and guess who I saw at the Farmers Market? My favorite chiropractor, Vijay Patel, and one of our good friends, Margaret. Hey, Margaret. And what we're going to talk to you about today is trigger point therapy. So if you've ever had a problem, Margaret is actually going to share this with us a little bit. So if you've ever had a problem with your back where you're having some muscular soreness, it just won't kind of go away. It's like achy, and how do people present that and describe it, Vijay?
Yeah, when they come in, they usually, if like for example, Margaret said she was running today and you got a little spasm in the back. So that can be caused by jamming of facet joints in the lower back. There are joints that are in the back of the spine, and when you're running and you've got the curve in the back and you're hitting hard, or it's kind of like it's the same pain you feel if you've ever stepped down off of a step that you realize was a little deeper than you thought, and then you get that little jam in your back. That's a facet joint that usually generates pain, and when that facet gets irritated, the muscles around it will immediately go into spasm in an effort to protect that joint. And there's a nerve that comes out from the spinal cord and out just in front of the facet. When that facet joint swells, it hits the nerve and causes the muscles to go into spasm, and that's what usually happens to cause the symptoms that the patient reports. And what we do for that, if that's what the next question was going to be, is number one, we relieve the pressure on the joint through manipulation. We may also do some exercises that help to release the facet joint, open up the facet joint, and we also do some trigger point therapy, and we may use acupuncture needles, or we may use our hands and fingers, which I'll demonstrate for you today. So today what you're going to basically do is some things that you can do without very invasive and having type stuff and basic stuff. So Margaret has volunteered here, and I'm going to go ahead and I wonder if I can pause this and switch. Hold on. So Margaret, go ahead and tell us a little bit about it.
So I was out running trails this morning, and of course on trails, you know, you're jumping over things, and there was a log across the trail, and I jumped over that, and I landed hard down on my left foot.
That's like that, kind of like you just,
right
yeah.
Up, spasmed up into my back, and then down my left side. So
VJ's now going to help her with that. So go ahead, VJ, do your thing.
Awesome. All right, why don't you go ahead and lie down? I'm going to go ahead and isolate. So I always say lie down. Sit down over here. Is that high enough for you? Can you raise it up a little bit? How's that? Better? Left side, Margaret. So the QL muscle is a large muscle that goes from the iliac crest, which is the top of the pelvis. It goes upwards and attaches to the spine, all the way from the upper lumbar spine, like right about here. Am I right on a hot spot, Margaret? And it courses all the way down, right over into the pelvis. And the way we access it, I usually push in from the side, just kind of very gently press the muscle, and I hold that little trigger point there like that. I ask the patient to kind of focus on breathing and relaxing. Am I on the hot spot there, Margaret?
I've always felt that when you do this, it's almost like the patient is really kind of doing the magic. You're identifying it, and they're doing the relaxation.
Pretty much.
Right? So it's all about identifying that point and then focusing on and relaxing that point.
You got it.
Okay.
And
cool.
Where the patient is able to get that muscle to relax, then that facet joint is not being squeezed as much, and then the patient has less pain. The one benefit that the patient does get from the pressure is something called liberation of lactic acid. Lactic acid is something that accumulates in these types of, in any muscle that becomes spasm. There's small capillaries in the muscles, and the capillaries are what brings nutrition, hydration, energy to the muscle, and also carries away lactic acid and carbon dioxide.
The waste products.
The waste products. So when we put some pressure on a muscle like this, we're basically squeezing out the lactic acid, thereby reducing pain and spasm, and increasing circulation. Often after I'm done doing trigger point therapy or any manual therapy, and if I look at the muscle, it'll be really bright red in the area that I worked on because we have increased circulation. And with that being said, it's imperative that when you get any type of work like this done, that you are well hydrated. I can't.
How do you tell if you're well hydrated?
Well, number one, you shouldn't be thirsty. Another way to tell whether you're hydrated is in some cases you can look at people's skin. You can feel their muscles. If your muscles always tend to feel ropey, hard, tight, then chances are you're not getting enough water.
Okay.
And when I say water, water is water. Coffee is not water. Soda is not water. Even a lot of the sports drinks, I don't really call
Bourbon is not water.
Bourbon is not water, even though you use healthy good water in bourbon. But no, bourbon is not water either. So water, I like to call just water. You can use like a green tea, unsweetened products to hydrate yourself. But try to avoid anything that has a lot of protein, sugar, caffeine, or stimulants, because they act as diuretics, or they require water to.
They pull water from the tissue, sure.
Right, they pull water from the tissue.
I usually use the pee test, where if your urine's kind of clear, you're pretty well hydrated. If it's a little bit dark, but that takes time, and you actually have to be able to pee to sell it.
Absolutely, absolutely. Typically, a urine color is also another good indicator. Most of the time, however, for those people who take a lot of supplements, if you're taking vitamins, protein shakes, you will tend to always have a slightly darker color, only because a lot of the spillover from the B vitamins.
Sure.
But that is one good way to look at it, especially if you're looking at kids. You want it to be a very light yellow, not a very dark yellow. If it's dark yellow, your kidney's been working too hard to concentrate that urine because you don't have enough water in your system to begin with. But yes, that is another very, very important way to tell.
How's that feeling, Margaret?
Is it any less painful now than it was when we started?
Yeah.
A little bit?
Yep.
Fantastic. So what I like to do now is I'm going to move into a stretch.
Okay.
I'm going to show a stretch for these muscles. Margaret, you can lift your head up. I'm going to go ahead and demonstrate a stretch. You can do one as well. I'll bring this chair over. Yeah. There are two stretches if you want to alleviate some of the pain in the lower back and the spasm. One stretch is called the seated lumbar erector. You can see this on our website. You can take a look at our videos.
What's your website?
It's apmt.us. www.apmt.us. I'll pull Paul, Mary, Tom.
I'll throw something on there so that they can.
This is one stretch here. It's called the seated lumbar erector. You just hang down. You want to let your chest drop in between your legs. The focus here is on relaxation of the muscles in the lower back.
Okay.
Where you're going to feel the stretching is right down in here, and a little bit on the inside of the thighs.
Okay.
And the goal is to just focus on your breathing. And then after about 30 seconds, I like to have my patients put their hands on their thighs and slowly push
Sorry about
themselves
the camera
up.
work, ladies.
And what you want to try to do is you want to try and avoid popping up too quickly. Sometimes that can cause your back to go into spasm. That's stretch number one. I think most of my patients who visit me at my office know that stretch if you've had back pain. Another stretch is called the seated QL. The way you do this, you sit off the edge of a chair, cross one leg over the other, gently press the cross knee down, drop that opposite shoulder and reach over and forward. And you want to hold this stretch for about 30 seconds and then slowly release. That will stretch that QL muscle I was talking about in the back, from the pelvis to the spine.
Cool.
Margaret, you want to try that really quick?
Yeah.
Thanks.
Both of them? Or the
To do the seated QL, I think that's one that targets that lower back. You got it.
So, tell me about, like, if we can't get to you because, you know, it's Sunday and you're at the farmer's market or something like that. What about, I know you've mentioned a tennis ball or a lacrosse ball.
Absolutely.
So how would we go about, like, taking advantage of something like that to kind of give us some relief before we can get into your office and get some treatments?
Absolutely. Margaret, that's perfect job. So what you do with a tennis ball or a lacrosse ball, you get the ball, either you can put it on the floor or you can put it against a wall, and then what you would do is you basically just lean up against that area. So if you happen to have a trigger point in your glute or you happen to have a trigger point in your back, you just lean right up against the wall, and then you want to open up that side to stretch the muscle open as you lean against it. Often it's probably best done on a matted surface on the floor. When you're pushing or when you're using the ball, particularly into the lower back, it's important that you don't put your entire body weight into that.
Okay, that's good to know.
Because in some cases, that can aggravate your facet. You just want to be in a slightly flexed position, or you can use one of the massage Theracane sticks.
Right.
I don't think we have one here, but I'll probably bring one in some future weeks.
I brought some things here. I don't know if this one I like. It's kind of got these metal balls on them, and it's better with a partner type of a thing.
It is better with a partner.
Where
Maybe you
they're
didn't have
kind
a
of
partner.
digging it. But yeah, I was going to say you can sit on that.
You can sit right on it. and then when you cross that leg, you'll feel that trigger point right into the gluteus space. You do it seated. Ideally, it's best done on the floor. And in that case, we would just put something like this here. Can you see me okay here?
I think so.
You cross the side that you want to trigger point, and you sit right back, right down into it, just like that. And then you roll up and down, and massaging the different areas that you have, whether you have sciatic pain or hip pain. I'll help release some of those trigger points. When you do this type of work, make sure that you don't have the balls push into any bony prominences. You always want it on a fleshier part, the muscle, and not on the bone or on a bursa, because that can, in some cases, aggravate patients. But these stretches are very straightforward ways to release some of that pain and spasm. Often I recommend magnesium for a lot of my patients who have tight muscles, about 200 milligrams twice a day, but those tend to work really well.
So I go to, full disclosure, I go to VJ all the time. I use him he's like my athletic trainer when I have something going on, and I always have something going on because I'm active. And I'll just give you a quick story. I was in, what was it, 2 weeks ago?
I think so.
I came in for a trigger point in my shoulder. I could barely move my shoulder. They took their thumbs and did awful things to me, but I left feeling great. It was amazing. I was so much better with one treatment. Now, I tend to respond pretty quickly because I'm active. It may take a little bit more time, but if you're active, you will respond better. So we just wanted to tell you, I'm going to kind of wrap things up here, you guys, for you. Few things I want to say. If you need a great chiropractor, Beach, what's your phone number?
847-222-9060. That's the office number.
Okay, and I will tell you this. So when you go in, you're going to get evaluated. He's not just going to start bending and doing stuff. He goes through this long evaluation where he kind of makes sure that he's giving you the exact spot and the right stuff done. So it's very precise, and I like that about you. And let's see, what else can we mention? They just have great people over there, right, Margaret?
Oh, definitely. If they will take care of you, you will learn how to make yourself better. You do need, of course, to take responsibility for that, and that is going to be the key. The therapy, getting things going, and great staff. Everybody's awesome there.
So I'm really happy to be able to work with VJ and his staff because it gives me an added level of ability to help my patients and my customers. So we're going to wrap this up for today. I want everybody to come on down to the farmer's market and get some good fruits and vegetables. Check out VJ's tent and come to some of my classes. We fit your goals, we fit your needs, we fit you.